Welcome, everyone. We are reporting live today from Cincinnati, Ohio. It is a very dark and drizzly day today. I'm afraid the heat in this area has been the highest it's been in a number of years. And now, of course, it's followed by a significant amount of rain. So we are indoors today and are trying to stay off location. Today's discussion is going to be fairly serious. Today we're going to be talking about mental health. We're going to be talking and fearing. Hello, Dr.
Hello.
Sheila. Hey, nice to have you with us.
Thank you.
I'm going to give a little bit more of an intro and then I'm going to pass it to you. I was remarking earlier that Dr. Hoehn is the easiest person to get online for Facebook. You wouldn't believe how difficult it can be, but it can be challenging and no challenges here. But as I was saying, today we're going to talk a bit about mental health and particularly focused in the area of wellness because, you know, as I go through and I'm looking at developing these national strategies, what I'm really looking for are solutions. We have to define the issues. We have to be able to diagnose the problems in order to get to those solutions. But ultimately, the goal really is to determine what's working and how do we do more of it. I was sharing earlier today online as well as with Dr. Hoehn that we had a neighbor friend who committed suicide this weekend. And for me, it just brings it all home. You know, we want to be able to protect our children, our friends, our spouses, our community, and yet these struggles are affecting everyone. When I look at the statistics for healthcare, one of the points that comes up in the census is that we have a significant number of what they call deaths of despair. I mean, let that sink in for a minute, right? I mean, this is really serious, and it's uncomfortable to talk about. It's uncomfortable to see people hurting, and yet at the same time, if we don't, then we don't know how to intervene. We don't know when to intervene, and we don't know where to get them help. And so we need to talk from every angle, both how do we recognize issues, how do we help people find where they need to be, and also how do we deal from a prevention perspective, right? Focusing on wellness initially and helping people from young to old to be able to function in our society and be ready for not only the chaos that we see constantly getting larger and wider in our nation, but that we know is going to continue to widen and impact individuals as well as communities. So, Dr. Hoehn, I know I covered a lot there, but I also know, given your wide background and experience, it fits in nicely with a lot of the work that you're doing, both from the recognition, but also the prevention space. So I'd like to pass it to you and tell us a little bit about your background, your practice today, and kind of how you got to where you are.
Okay, great. Thank you. First, I want to start by saying I'm sorry for your loss. I'm sorry for the family's loss. And this is a very important topic and very relevant. So thank you for sharing that. A little bit about my history. I have a dual master's in mental health and marriage and family counseling, a professional master's certificate in communication and publication, and a doctorate in family counseling with post-grad work at Harvard and Hebrew U, where I looked at the effect of the three monotheistic religions on cultural narratives, family narratives, and societal narratives. I also looked at the self-immolation of Afghan women who have been forced into marriages early on. And my main areas of study have been grief processing through digital technology and social media, with a sub-study on mass shootings and school shootings. So that's a little bit about my history, my educational background, and some of my experiences as far as counseling and therapy and addressing wellness. I'm currently the co-owner of the Zen Life Center in Winter Springs, Florida, where we've been in business for 21 years now. And we focus on health and wellness through martial arts and wellness programs. I'm also the president and founder of Blue Earth Media Productions and the Orlando representative for Conscious Capitalism and the community director for Florida for Good. And both of those organizations recognize, promote businesses that emphasize both profit and scaling and growth, along with positive impact on community and planet. So that's a little bit about what I'm doing.
So the punchline is you will sleep when?
When I can.
Because you are also in all of this a remarkable mama to
Oh,
multiple
thank you.
children, and one that herself has significant issues that you're having to watch out for as well. So I mean, you have your hands full.
Yeah, but I love what I'm doing, and I'm a very purpose-driven person. So to me, I don't have a separate set of values for the work I do and for my home life. It's all integrated, and I bring my kids along with that, and hopefully I'm helping them to become resilient and part of the solution rather than part of the problem.
I love that statement, and particularly the point about integration. We've talked so much about work-life balance. And I started saying in my former job in government, I said, I think we have to start talking about work-life integration, because people who are getting excited, you know, we don't work a job anymore just to get a paycheck. Some do,
Absolutely.
but for the most part, we are trying to find those positions that excite us personally and help us, probably I should say, focus our passions on those things that can be beneficial to the world, and share them with our children. Like you, I bring my kids along. I was wondering
Yes.
if you could talk a little bit more about that and kind of how you get to that space.
Um, I guess it's just part of the DNA of who I am, and I've been, I come from a very impoverished background, and from an early age, I said I just wanted things to be different, and I was always just purpose driven, and I've been afforded the opportunity to meet a lot of wonderful human beings that I've been able to learn from and emulate and develop relationships with, and kind of see the world from a different perspective. And so I just always knew that to me, I have one life and I want to make it matter, and I want to make a difference. And that's what drives me as a person, as a parent, as a professional, as an employer. So yeah.
Inspiring to say the least, right? And so
Yeah.
how do we as a society start to unpack this, right, to get people to a life as you just described, right? In my head, I always think, what's the ideal, what's the goal? And that's difficult because for every person it's very different. But conceptually, what you've just described, this work-life integration, it really kind of fits as a general model goal for anyone. It's just that their integration may be slightly different depending on their interests. But how do we get there, right? There are so many steps before we arrive at this point where we are focused on ourselves and others, where we are comfortable in ourselves and the ability to interact with others. And along the way, there's a lot of bumps. So
Mm-hmm.
as we think about this, what age group do we start
What age do we start?
thinking about wellness and aiming towards
Oh,
a
right.
life? Yeah.
I think immediately, and I think it comes from the foundation. It has to come from the parents in the home in the beginning, and that we start thinking about it immediately. In utero, proper nutrition, staying away from teratogens, proper health care, all of that. And it comes, I think it's not only the responsibility of the family, but it's the responsibility of society also, in the cultural narratives that we have, that it really is a village, and we need to return to that kind of thinking that it's a village. I'm a big proponent of self-reliance, but I also recognize that free will is different for every person, and some people need more help than other people. So recognizing the people that need help and intervening, the earlier we intervene, the more likely they are able to integrate those. I think the millennial generation and Generation Z gets a lot of flack for a lot of things that are misleading, but I think what they do really well is that they realize that if they're going to work all the time, they want that work to have meaning, and they want to make a difference at the same time. And I think recognizing that you can do both at the same time, for so long it's been a dichotomy. It's either one or the other. Either you make profits, or you have an impact. Either you have a for-profit business or a non-profit business. But what we're learning now, and we're seeing this trend across the world, not only in the United States, is that you can absolutely do both, and business has to be run from the perspective to stay relevant that you can do both, because there's so many externalities if you do not. We're running out of resources, where people are dying, suicide rates are increasing, mass shootings are increasing. So we recognize that there has to be a change, and for-profit business is the biggest catalyst that we have to make this change. People can make good money, make a good living, and there should be no shame in wanting to do that while making a positive impact on people and planet at the same time. And I think what the silver lining to everything that is going on is that kids are starting to recognize that and advocate for that.
Yeah, this next generation has a whole another set of challenges that the generation prior to you and I
Yes,
had.
yeah.
And yet they also have a number of tools that we didn't have and that our parents didn't have. But I think, every Tuesday I do a segment with my dad. And so, my dad represents that generation before me, and we talk a lot about the perception of that generation, of the generation, quite frankly, that is after us. And oftentimes it comes out, there are these rules, we follow these rules, and if you follow these rules, you will have a good life. And I said, but Dad, those rules don't work for everyone. And the definition of good life is not the same for everyone. And as we go into this next world, this next space that's coming, the landscape is totally different as well. So now we have social media, which may seem like a small change. Oh, kids are on the computer more often, or they're on their phones more often, but it is far more pervasive than that. From my perspective, I'll say, what happened in my dad's generation was that there was a line of privacy. And there were things you didn't share because when you were in front of someone, you almost had this response of, oh, that I'm going to keep to myself. That's where that phrase said behind your back comes from, right? But now we are so used to sharing information, and we are so used to seeing people share information, that those lines are not the same anymore. And that personal privacy, those lines are blurred. So the experiences of young people is going to be very different going forward. What are some of the trends that you're seeing, both from an individual, but also from a family and society level?
I think that digital technology, social media, is both a blessing and a curse. There are good things about it, and there are serious issues that need to be addressed in relation to it. The trend is that there seems to be less development of personal relationships and human contact and more screen time. So there's this veiling effect. And what we know from research, if you can dehumanize or veil something, it's easier to abuse that person or create havoc in another person's life, because you get to dehumanize them and you also get to hide behind a veil. So you'll see a lot more bullying going on, a lot more negative comments on even posts that are meant to be positive and inspiring. And you'll just see this where kids are also, parents are relying on digital technology and social media to babysit their kids and raise their kids, which is a real problem because they need that attachment and they also need the relationship and the role modeling from their parents and significant others. But it also offers them opportunities to connect in the world in a much different way, and could be a much more meaningful way, and they get opportunities to learn more about the world, to see what's going on, to see what's going on across the world and compare it to what they know. So they get to leave more from knowing the world, not only from their own perspective, but being able to look at it from the outside and somebody else's perspective, which I think is a good opportunity. They also have more access to knowledge generally. So I think there's both pluses and drawbacks, and we have to address, there are significant drawbacks that we have to address in relation to mass shootings also and school shootings.
Yeah, so let's take two of the points that you made there. One was attachment. And we know from the literature, attachment is enormously important in development. And the second one you said was the benefit of being able to see a situation from another person's perspective. Perspective taking can also be very beneficial. Tell me a little bit more about, starting with attachment. What happens when I always have this screen between me and the person I'm connecting to? What does that do to attachment? Because maybe I feel like I'm connecting to people, but am I in the same way?
You're not. In my research on grieving through social technology and digital technology, it can be a very powerful tool. And it changed the narrative around grieving and what is expected You know, it was previously thought that you should grieve a loss and get over it, and then put all signs of that person away and be able to just get over it in a relatively short amount of time. What the literature now shows that if you can hold on to that person while letting go at the same time, it's actually more meaningful to you, and that everybody has their own timetable for how much they let go, when they let go, and what it means to them. And social media really allows them to do that. So it does help as far as that kind of attachment, but attachment with parents when you or significant others, when you've always have a screen that's getting your attention, the obvious thing is that that person isn't really getting your attention. You could be sitting in the same room where you might normally have had a conversation, and you're relying both on the oral communication and the nonverbal communication. You're relying on more human contact. We know from studies that actual physical human contact is very important. You're not getting that when you're sitting behind a screen all the time. And it tends to, like I said, dehumanize. It tends to make you see people and situations not only in a broader sense, but also sort of detached from them also, and have less emotional energy invested in it in some sense. I don't know if that makes sense, or if that answered your question.
It makes complete sense. I mean, yeah, the punchline is that there are some benefits to being able to connect and to move through a process, but not completely detach if we're dealing with loss. But on the other hand, there is real measurable need for physical attachment and time. I'll share a story. My daughter was born at 23 weeks, and there are these studies about what they call kangarooing. And what they found, it was just happenstance that they found out this information, but they had children in Colombia who were very ill, and they were not expected to survive, and they didn't have enough beds in a hospital. So they called the parents whose children were the sickest and said, come hold your children until they pass, because we don't have any more that we can do for them. And those were the children that started living. And they said, something is different here. What is it? This is not what we expected at all. And more studies were conducted, and they in fact found that it was touch. That physical presence, that attachment to another human mattered so significantly that it was literally saving these children's lives. And as a result, if you are the parent of a child in the NICU, they will move mountains, to say the least, to ensure that you have the ability to hold your child, because they have found that there's measurable medical impact of that kind of attachment. And so, you know, if we think about that in our teenagers and our middle schoolers and some of what's happening in school shootings, we think about what are the personas and experiences of people who get to a point where they take others' lives. What are some of the factors that we see are common across these individuals?
Right. And I think it's really important to talk about mental illness and mental health in relation to mass shootings. But I think that comes with a caveat that we recognize that it is a very complex problem that definitely deserves a very comprehensive approach to figuring out the problem, addressing the problem, and preventing the problem. So although we're talking about mental health mainly today, I want to acknowledge that it's much more nuanced than that. And that I think it's really important to differentiate between mental illness and mental health, because we run the risk, if we don't differentiate between the two, of stigmatizing a whole group of people. A significant group of people in the United States, 1 in 5 Americans suffer from mental illness. It's very prevalent in the United States. And the majority of these people, the vast majority, have never and will never commit a violent act. And so we have to be very careful with that. A lot of times you'll hear commentators state that there is no serious link between serious mental illness and mass shootings. And it's important to recognize when they say serious mental illness, they're talking about mental illness and not mental health. And mental illness is a clinical diagnosis of a disorder. And some of these disorders fall along the lines of mood disorders, personality disorders, schizophrenia, trauma disorders, anxiety disorders, eating disorders. Mental health, on the other side, is in relation to how we handle our emotional and mental processes and coping skills, how we view ourselves, how we interact with others, how we're just basically coping on a daily basis. And many of us go through difficult times in life where our coping skills are not that great, where we're having struggles with our mental health, but that does not warrant a mental health diagnosis of illness. So we have to be careful. 25% of mass shooters have been shown to have a clinical diagnosis, and that's a small percentage, 25. But mental health is much more prevalent when we're talking about mass shootings, and specifically school shooters. There's a strong link between poor mental health and mass shootings. A lot of these shooters have been depressed, had suicidal ideation for quite a while, had multiple stressors, were very anxious, had delusions, and they were transient. So they had problems with coping. And what they've found is they had specific problems with dealing with conflict and developing resiliency. And these are mental health problems. These are not mental illnesses. So we can acknowledge that mental health plays a significant role. And if we can acknowledge this, then we can intervene at a much earlier stage. So all of these school shooters that were studied by both the FDI and Jillian Peterson, who just studied all the mass shootings, school shootings over the last 20 years, point to the fact that every single shooter that went into a school went in with the intent to die. And over 80% of them were suicidal a long time prior to the attack. So if we can recognize a lot of these kids that are crying out for help, that engage in self-harm, which a lot of them do, that have outbursts of anger, that look for help in ways that we don't traditionally, think of asking for help, or a healthy person doesn't ask for help, like cutting themselves, leaking their plans. A majority of them leak their plans ahead of time. They told people about it. So if we can, they made threats to other people. So if we can intervene at this time and look at it less of a nuance and more of a time to connect with the individual, less on punishing that person, expelling that person, or just sending them away and not dealing with them anymore, or maybe just stabilizing them in the midst of a crisis. If we can actually intervene and develop healthy relationships at that time, then they're less likely to go on to commit these acts. There was a case where a school teacher had an active shooter come into her room, and he lined up all the young children against the wall and executed them one by one in front of her. 2 years prior to that, that active shooter was in her English class, and she was a brand new teacher. He walked up to her and rolled up his sleeve and showed her his cut marks. He had been cut in his arm. She was a new teacher. She didn't know how to respond, and in the end, there was no follow-up. There was nothing done for him. So we have to say something when we see something. We have to make sure we follow through, and that we create a narrative where it's okay to say something. It's okay for adults to say something to authorities. It's okay for students to say something to the adults and the attendees. There was another instance where, this is almost in every single case, but there was a active shooter that was thwarted by the principal. And what happened is the principal went to the bathroom and he saw this shooter all dressed in black, carrying two shotguns, and he was able to de-escalate the situation, disarm the shooter in a very calm way just by talking to him and trying to relate to him. And he was successful. And when he was asked why he thought that mattered, or what mattered most as far as active shooters, he told them relationships. And if you look at previous studies, decades and decades of empirically based studies, peer-reviewed studies show that resiliency is developed if even one person of authority steps in and develops a relationship with that child of trust, nurturing, and unconditional positive regard for that child. If one person can step in, that is what's made the biggest difference in resiliency and breaking patterns of family abuse, and it's showed over and over. So a lot of that makes sense. So what they've also found is that these shooters have all been male, primarily white. They have difficulties with processing grievances, so they are injustice collectors. So when something happens to them, they get very upset and they don't know how to deal with it or cope with it, or just kind of get rid of deal with those most intense feelings like most of us do. So they collect all these injustices, and at first it starts with being angry at the person or group that caused the injustice, but then it quickly spreads to a whole group of people. Everybody, they're angry with everybody and they want retribution. They have a lot of rage. And they also want to be famous because they want to feel like they have some sense of power, that they're important in some way. So this is what makes up an active shooter. We've recognized that there is no one distinctive profile that you can say that every active shooter fits, but these are patterns that they have in common. And we have to address the mental health. We have to address access to weapons. We have to address to a social network, support systems. There's a whole bunch of areas that have to be addressed if we want to prevent the problem. So
I'm going to digest and tie a bow around some of this, because this is phenomenal, right? This is getting to what's really happening and identifying some ways that people can be involved. A couple of things I want to highlight. One, I keep saying ecosystem is the word of the decade, because I am so tired of hearing punchlines of how we're going to solve something, anything. We are not going to solve something by having one piece of legislation passed. We're not going to solve anything by having one protocol designed. And that is true whether I'm talking about the environment, or we're talking about active shooters, or we're talking about military. Everything has to be looked at as a whole picture, and that includes humans as well. So I'm so glad that you pointed that out, because I think that does mean that we need to go after legislation. It does mean we need to think about mental health. It does mean we need to understand mental illness and the differences. But any one thing is not enough. We have to solve the problem holistically. The second thing you brought up was this notion of differences between mental illness and mental health. And particularly, one of the things I want to add to that is that for those who are unaware how it works, Baker acting is something that, as a psychologist, we can do. And yet, if someone is not diagnosed with mental illness, we're less likely to see them in the office. If they are having mental health problems, but they are, as you've noted, not necessarily sharing them with people in a way that someone knows how to handle it, again, we're not necessarily in a position where any one person has the knowledge to be able to report. So we run into your third point, which is we need to educate and empower everyone to recognize, hey, that didn't seem quite right. We see it in our airports all the time. If you see something, say something, right? I was one time I think it was in London actually, and there was a bag, and it had just been sitting there all by itself, packed away, just the right size, and I thought, something's just not right about that. We went and got somebody to come and take care of it, and it did turn into an incident, so I'm glad we said something. We need to get to a point where we also recognize that in our friends, our neighbors, and others, hey, something doesn't seem right here. But I think one of the pushbacks that we hear is twofold. One, people are not sure that they are seeing something that's actually a problem, right? They're nervous to report because maybe it will reflect on them. And the second thing is, who do they report to? And what do they say? Well, I saw something that didn't seem right. Is there somewhere for people to go? And I think this is where at least one piece of this ecosystem where government can be beneficial. What would be your recommendation if someone sees or hears something that doesn't seem right? Where do they go?
They go to an adult that they trust. If you're talking about kids, whether that be an authority figure at school or their family. And I know for a lot of them, there's this narrative that exists that if you say something, you're a bad person, you've snitched, or you might get somebody in trouble. we have to help. We have to have discussions, open discussions in schools with our teachers and with our family of why it's okay to say something and that it is okay, so that we start to change that narrative. And you bring up a good point about, and I just want to talk a little bit about Baker acting. We do have Baker acting, which is great, but Baker acting is not enough in itself, because to stabilize a crisis is one thing. A lot of times they get stabilized with psychotropic medication and then they're sent on their way. And there's no third party to follow up on a consistent basis to make sure if that medication is working for them, they stay compliant with it, or that they have other evidence-based opportunities to get help, treatments to get help, like cognitive therapy behavior, cognitive behavioral therapy, or anything like that. We've turned into a culture where we think psychotropic medication is a panacea for everything. And there are many issues that we need to address in the healthcare system and in relation to psychotropic medication. There have been many studies that show that actually 36, I'm sorry, were on psychotropic medications at the time they committed the act. Now, psychotropic medications can be a very powerful and valuable tool to help people. I know from counseling myself that I've had clients that cannot even leave their home. They have so much anxiety unless they are on psychotropic medication. They cannot function. But we run the risk of abusing psychotropic medication. And as far as now, doctors, your primary doctor can prescribe a medication to you without any formal training on diagnosing a clinical illness, a mental illness. And also there's an ethical dilemma when doctors and psychiatrists are paid large amounts of money to promote psychotropic medications through speaking and consulting fees. So you have the pharmaceutical industry is a huge business. So you have now this business that has a conflict of who it's serving. Is it serving its shareholders or is it serving its patients? And what we've seen many times recently is that the patients are the ones that end up being compromised in lieu of the shareholders. So how are we going to address this? How are we going to address the fact that people are going in to their primary doctor and getting a psychotropic medication? What if there's not a lot of evidence of what these medications do in the long term to these children. There are many vulnerable children from foster care that do not have proper attachment, do not have proper family or social support, that are put on psychotropic drugs. They're not put on one psychotropic drug, they're put on several psychotropic drugs. And there's no evidence of what this, or long-term studies of what this will do to their mental or physical health in the long run. Even infants are being prescribed this medication. And what we do know is that it's a valuable tool for some, but we also know, we have all heard the disclaimers that this drug, specifically antipsychotics, selective serotonin reuptake inhibitors, for depression, that they can cause more aggressive behavior, suicidal and homicidal ideation. They can cause paranoia, delusions, which will exacerbate poor mental health. And there have been some studies that are linking some of these psychotropic drugs to active shooters, and we'll have to see how that plays out. But this has to be addressed when we're looking at the mental health system and medication and stabilizing a crisis. And are doctors sharing not only the medication, but are they sharing other evidence-based treatment options? I don't think they are. So we need to work together as healthcare professionals and primary doctors and address this from many different levels. And I guess that's just what your comments triggered for me, is that we have to acknowledge this also.
Yeah, I mean, we have to look at all the layers of this. And I know I'm sure an aggressive compliment in agreement to what you're saying. I feel so much frustration when I hear just a blanket, the way we're going to solve healthcare is simply to either have or not have Obamacare or have Medicare for all. That's a punchline. That is not taking care of the entire system. And this system, it is breaking from every direction. And I don't just mean in the delivery options. I mean in the way that people are trying to navigate the complexity of what you just described. Right? For a parent who has brought a young person into this world and is trying to understand the struggles that they're having, this is an overwhelming amount of information. But to a child who is transient who is moving through a foster system, or who is moving from classroom to classroom, from place to place for other reasons. Now it's the child trying to navigate this complex system. And so at every layer, the challenges just stack. And absolutely agree, crisis intervention is necessary, but absolutely by no means sufficient for the involvement and support that we need. And the way I've always viewed this is that if we look around and this is a pervasive problem, then underlying it, there are some real community and societal issues that we have to solve, because it isn't likely the case that we went from one generation to 2 generations later and we have a significant increase in mental health struggles. It is more likely the case that we are trying to really control and move everybody in the same direction, and it's not working. One of the things we talk about in military substantially is how to increase resilience. And certainly this came about partly because we have a lot of PTSD, but it also comes about recognizing that if people need to be able to make decisions under stress, their ability to recover and stay focused and to maintain under those high stress environments matters, not only to keeping themselves alive, but keeping their teammates alive as well. And so it's very interesting how some of that work then spills over into the other spaces. And so I'll tie a bow around that, which is to say that when we just finished this education reform plan, one of the things I fought for very heavily was to make sure that we had social and emotional development as an educational pillar, as important as important as all the knowledge-based pieces on math, science, English, etc. If you are not ready for life, then all of that doesn't matter anyway. And it is so important that we recognize that kids are not always learning this anymore. And this needs to come into the classroom so that they recognize it in themselves and are empowered to ask for help in ways that people can hear, but also recognize it in their communities. And those may be their other classmates. It's you are a wealth of knowledge. I think I could talk to you for 3 hours straight, because I'm soaking it all in. If you were to make 2 last points, and I'll scope them a little bit.
Okay.
2 points that you would like to see happening in, when I say the word government program, what I mean is helping to facilitate a cultural shift in our country. What I'm not talking about are necessarily laws. So this facilitation concept, how can government support individuals, communities, and really the greater society to move in a direction that promotes wellness and a recognition for and the ability to talk about mental health?
By making resources more available, putting an emphasis on educating people how to get those resources. A lot of people that don't have health insurance, they can get Medicare and Medicaid, but to get to that level to be accepted and go through all that red tape is a lot for some people. So there's a lot of scaffolding that needs to be done. And I want to make a point about schools and teachers, just because you brought it up, and the fact that we need to do a lot more to support our schools and our teachers. We need to pay our teachers more. We need to educate them on mental health crisis and mental health well-being. And we need to support them more by giving them additional help in the classroom, cutting down classroom size, emphasizing standardized testing less and life skills more. All of that is important. The competition and the education, as far as traditional education, is really important to stay competitive nation. But we can't be a competitive nation if we're broken and we can't take care of our citizens. So right now, bullying is a big problem. Oversized classrooms, teachers are burnt out, and now we're going to ask them to look for these warning signs and to intervene. We can't ask them to do that unless we support them and we give them access to support. So I just want to really emphasize that we need to change that narrative around that. We need to take action. We don't need to just talk about it all the time. We've heard this for years that they need more support, but it's not being done. So I think that's really important. And I don't know, I kind of lost what
that is exactly where my head goes, is that we have to create that support. And it was interesting inside of government when I realized Department of Ed was not going to be the place where we could get that support. And so when I went to the Pentagon, I said, you have a problem? And they said, we do? I said, yes, you do. I said, you have a 25% eligibility rate that's declining. And I cannot give you any more support in force education and training, which is the department we worked in. In other words, I said, these young people are not ready for advanced level military training because they're not ready for life to begin with. And so I said, military dollars have got to go to supporting K-12 because we need to be able to say it's not enough to know information. You have to be ready to handle the chaos of life. And frankly, if you don't, then nothing else matters. But I think it's poignant that it takes the military to start saying, we're not going to be able to defend this country if we don't take care of our young people. And in fact, to be really specific about it, in Orlando, every year they host the largest modeling and simulation conference in the world. People don't realize that Orlando is the international hub for modeling and simulation. And military sponsors it. Yes, every year one of the branches sponsors it, and they pick the theme. This year it's the Air Force, and you know what the theme is? Social and emotional development. And they start out. Yep, they start out the video.
Yay, our military.
Yeah, I know. Who would have thought? I about fell out of my chair when they gave the announcement last year, because they started off discussing attachment theory and how as very, very young people, we need to make sure that all our citizens are prepared for life. Because if we need a portion of our citizens to be prepared to defend this nation, we've got to make sure that we're all resilient enough for what's happening. And yeah, I mean, talk about an exclamation point on that. Well, thank you so much for being with us today. And thank you so much for the information. I'm going to want to get copies of those articles if that's possible. And yeah, if you'll share some of the links with us, I'll attach them, or you can just respond here as well. And we can make sure that people have that information, because I think some of the review articles you pointed out about understanding what are some commonalities in the active shooters, and also the distinction in mental health and mental illness, just helping to educate people. They need to know the differences in these terms. So any of that is helpful. Thank you so much.
Thank you. Thank you for everything that you do.
Oh,
thank you.
We're getting to the bottom of things.
Yes. Talk to you soon.
Talk to you soon. Bye-bye.
All right. Bye.